So, Jan, how do you feel about our phase two starting tomorrow?
To be honest, I'm quite excited, Olivia, but the thing is, I'm a bit used to phase one and just, being at home. I don't know whether I'm ready to brace for the crowd. So what about yourself?
Exactly, I agree. And I feel the same trepidation, and especially knowing that we are expecting a phase two to last for a few months, I don't see the need to rush out in this weekend or even the next week or so in order to do all the things that we won't be able to do for the past few months. Well, we're happy, we're excited to reach this milestone, but even as phase two starts tomorrow, it's crucial to remember to be socially responsible. So let's bring in the Rophi Clinic's infectious diseases physician, Dr. Leong Hoe Nam, to discuss this. He's a familiar face on the big story, so thank you, Dr. Leong, for joining us once more. So, how do we strike a balance between enjoying the freedom of movement in phase two and doing our part to keep community cases low and stable? Four community transmissions were reported today. So how do we, keep that balance? Do we avoid multiple dining out sessions, perhaps?
It is difficult, isn't it? If you think about it, the more we go out, the more we dine out, the more we go back to our usual things and the things we enjoy, the greater risk there is to spread of the COVID-19. Now, but things are a little bit different between now and what it was in February and March. Number one, we are more aware of what the virus is and how it can spread. Number two, we are all masked up. Number three, we know about social distancing and we are actually doing it much better than what we were doing in February and March. And all of us have been bitten once very badly between the 4th of April, when the news was soon announced, all the way for 2 months to the 4th of June. Now, with all this in mind, I think the Singaporeans will have a lot more better sense now on how to prevent COVID-19 infections. So we are talking about keeping the social distancing. Now there are lines that are pasted on the grounds as to form the queues, and people are very mindful. Having masks available for everyone now, at the same time, we are socially reminding ourselves of wearing a mask properly. I do see people reminding others, hey, your mask is not worn properly, your nose is exposed. So having all these helps. And thirdly, this has been kind of ingrained into our minds, our new habit, our new normal. We go into the office, we go into the shopping malls, we actually have to do a safe entry. We have to trace together app that's running in the background to make sure that we are aware of who we are coming in contact with through Bluetooth technology. I think all these will help us in good state. Do I have evidence that all this will help? I think we have to look at some of the countries that were ahead of us in terms of the epidemic controls. We know of China, we know of Taiwan, Hong Kong, which actually did a very, very good job in actually controlling COVID-19. And thereafter they will relax, and then they had surgical masks, and they managed to control the illnesses as and when they come. Now, Italy is a very good example. We knew there were many cases, there were many deaths, the system was clearly overloaded. But guess what? Italy has opened up, the cafeterias are open, their pubs are open, and yet the number of cases that are happening in Italy are continuing to fall. The numbers are there, small, but the numbers are falling, which means the people are getting used to this new normal as what you and I are doing. This to me is a reassurance that if we continue our controlled phase two, not exuberant, go out and celebrate phase two, we will just be fine. So it all boils down to you and I, all of us, working together hand in hand.
Well said, Doctor, as always. Now, as we're hoping that our family and friends will be sensible about their social activities in phase two, we want to hear as well what the infectious diseases expert is doing this weekend. So what are your plans, Dr. Leong?
I must tell you, I tried to check out my favorite haunt. It's a nice little corner in a hotel, but they are closed. Okay, so seriously, number one, I will not rush out to go and eat at a restaurant. Instead, I would just look at the crowd, look at the situations. Number one, if we can, I'll call in advance to book. Number two, choose an hour where there's less bookings for the hotel or place which you want to go to. And then thereafter have your meal, and remember, mask down only when you eat, and thereafter when you finish eating, mask up again. And of course, when you're masked down, the temptation is to eat and talk. No, just eat, don't talk. And of course, the shopping malls are open. My wife reminded me that IKEA is open again, but it brings to mind the long queue before the circuit breaker that happened in April. Please, Singaporeans, don't rush out, don't queue up. The moment there's a queue, the moment there's a gathering of people, COVID-19 will lurk and spread infections. So a lot of common sense is necessary. I would like the restaurants and the places or the hairdressing salons to actually take bookings so that we do not crowd too much and yet have our enjoyment and have our safe distancing.
Right. Well, let's hope we see this situation from tomorrow onwards. Dr. Leong, what do you make of the activities allowed in phase 2? Are you concerned that the reopening isn't gradual enough, which would result in an infection spike?
I think it's a reasonable amount of opening. Ideally, you want it to be even slower, but it is a tussle between lives and livelihoods. But if you look at what has happened in Italy, and even in some of the cities in USA, I would actually use New York as an example. You can open up reasonably and yet have a very controlled number of viruses happening in the society. Now, one thing I want to remind everyone is this. I don't think we can get consistently 0 cases all the time. I'm very sure there will be a handful of cases, hopefully less than 5 in the community a day. But all of us must be prepared for the 20. We will see the second wave, but the second wave is not the huge wave as we expect, but a small ripple. The less of the big waves there are, the better. The smaller ripples are fine because the healthcare system can cope with it. The ripples will come and go and will threaten our shores repeatedly. What's important then is that we have a good, solid rampart against these waves. And this rampart is the solidarity of Singaporeans. It's us working together, not jumping into fun, but actually controlling ourselves, having restrictions on our needs and our wants, showing solidarity, working together with safe distancing, masking. All those will make a major difference in controlling the virus. So Singaporeans, let's build this rampart and block off the ripple waves.
Dr. Leong, just to round up our discussion today, what you can or cannot do, what is allowed or disallowed, there's so many things to be mindful of as phase 2 starts tomorrow. If there is one thing, the most critical thing that you emphasize that we should bear in mind, what would it be?
Very good. I want you to know what the secret of the trade for healthcare workers are, which is the surgical mask. We wear the surgical mask and we wear it correctly, covering the nose and covering the chin, and we do not touch the face at all. With this care, many patients with COVID-19 nursed with surgical masks, our healthcare workers are not infected. That is the bottom line. No matter what it is, your surgical mask must be good. On top of that, go for clean hands, go for safe distancing. When you have all these and you do it as well as a healthcare worker, my friend, you will be well covered, well protected. Remember, we have done it in the last couple of months on a very controlled measure. Know what? We're going to do it even better for the next couple of years with better surgical masks, better clean hands, and better social distancing.
Thank you so much, Dr. Leong. It's always a pleasure to have you on The Big Story. That was Dr. Leong Hoe Nam, an infectious diseases physician from the Rophi Clinic at Mount Elizabeth Novena.